Hi guys, my name is Ashley Styles and today I'll be talking to you guys about atrial fibrillation. First, what is atrial fibrillation? Atrial fibrillation is a quivering or irregular heartbeat. AFib causes the heart to beat at a faster rhythm, which doesn't allow the blood to be pumped completely from the heart's atria. Since the blood is not able to be pumped completely through the heart's atria, it increases an individual's chances of having blood clot or blood pooling. The CDC from 2009 to 2014 shows how many people were hospitalized due to AFib. AFib is the most common type of heart arrhythmia, and at least 2.7 to 6.1 million people are living with it. Signs and symptoms of atrial fibrillation include irregular heartbeat, heart palpitations, lightheadedness, extreme fatigue, shortness of breath, and chest pain. When it comes to risk factors for atrial fibrillation, there are a few that go into the mix. First is your age. The older you are, the greater risk of developing atrial fibrillation. Next is high blood pressure. When having high blood pressure, especially if it's not well controlled prior to being diagnosed with atrial fibrillation, it will cause you to make some lifestyle changes or medication to decrease your risk of atrial fibrillation. Next is obesity. People who are obese are at higher risk of developing atrial fibrillation. Next is heart disease. Anyone with heart disease, such as heart valve problems, congenital heart disease, congestive heart failure, coronary artery disease, or any other history of CVD, has an increased risk of atrial fibrillation. Other chronic conditions as well puts individuals at risk for atrial fibrillation, and those chronic conditions can range from thyroid problems, sleep apnea, metabolic syndrome, diabetes, chronic kidney disease, or lung disease. Next, drinking alcohol. For some people, drinking alcohol can trigger an episode of atrial fibrillation. Also, if that individual is a binge drinker, that can even put them at a higher risk for atrial fibrillation. Lastly is family history. An increased risk of atrial fibrillation is present in some families, which then may be a trickle-down effect for an individual that think they have signs and symptoms of atrial fibrillation. The pathophysiology. During atrial fibrillation, the heart's two chambers beat irregularly and chaotic. Those contractions are usually out of coordination with the lower chambers of the heart, which causes the irregular heartbeat. The atria usually beats as fast as 300 to 600 beats per minute. The AV mode, which usually transfers the beats from the atria to the ventricle, serves as that buffer, but since AFib causes the irregular heartbeat, the AV node is not able to transfer that electrical signal all the way down to the ventricles. Atrial fibrillation can occur in four ways: occasional, persistent, long-standing persistent, or permanent. Occasional atrial fibrillation, also known as paroxysmal atrial fibrillation, is a type of AFib that comes and goes. It'll last for a few minutes to an hour, and it can also stop on its own. Persistent atrial fibrillation usually starts as occasional AFib, and it usually lasts longer than a week. If it doesn't go away after a week, individuals usually get treated with medication from their cardiologist. Long-standing persistent AFib is usually when it occurs for longer than a year and it doesn't go away. If the AFib doesn't go away after a year, it can be treated with medication or surgery. Permanent AFib is also known as chronic atrial fibrillation, which usually is just treated by medication or sometimes surgeries depending on how bad your condition is. When it comes to AFib, there are many ways to be diagnosed. First is your medical history. To help diagnose AFib, your doctor could ask you about your eating habits, physical activity habits, family history, and other risk factors for atrial fibrillation or heart disease. Your doctor usually can ask you if you're having any signs and symptoms, and sometimes that information can help your doctor determine whether you have complications complication or other conditions that may be causing you to have AFib. Next is a physical exam. Your doctor can do a complete examination, and usually sometimes it's when people go for their annual checkup visit. And the examination will include an examination of your heart and lungs. Your doctor can check for too much thyroid hormone, such as your thyroid gland being larger than normal. You can check for legs and swelling of your feet, because that is also a sign of heart failure, or that your heart is larger than normal. Your doctor can check your resting pulse to see how fast your heart is beating at rest. Your doctor can listen to the rhythm of your heartbeat, can listen to your lungs and checks for signs of heart failure or infection. And they also can measure your blood pressure. Other ways they can diagnose are by doing diagnostic tests. Blood tests is an easy way for a doctor also to discover if you have AFib by having that doctor to be able to check your levels of potassium or thyroid hormone. ECG also is another tool which also shows the areas of poor blood flow to your heart and areas of the muscle that are not contracting normally, and if your heart was injured prior to any previous injury which resulted in poor blood flow. Lastly, there are two other tests. There's a chest x-ray and a stress test. Chest x-ray helps the physicians look for signs of complications from AFib, such as fluid buildup in the lungs or a heart that's larger than normal. And lastly, one that we are familiar with is stress testing, to look at changes in your heart activity that occurs with an increase in heart rate, recovery after exercise. Sometimes if the individual is not exercising or cannot perform the stress test, the doctor that is there can provide medicine to make your heart work harder and beat faster to see if you have any underlying signs and symptoms. When it comes to being diagnosed with AFib, there are a few changes that you have to make living with AFib very comfortable. 1 is healthy eating. 2 is being physically active. 3 is avoiding alcohol. 4 is managing your stress. 2nd is to stop smoking. Those who are diagnosed with AFib usually go the medication route. There are 4 medications that doctors usually prescribe to an individual that has AFib. 1 is a beta blocker. A beta blocker is something such as Atrial, which the heart lower chamber pumps blood through. The rate control when an individual is on a beta blocker is important because it allows the ventricles enough time to actually fill with blood, because with AFib, when the atria is constantly firing, it is not allowing the ventricles to fill up with blood. With this approach, the abnormal heart rhythm can continue sometimes, but you may feel better and have fewer symptoms. Next, blood thinners. Blood thinners are to prevent blood clots and lower the risk of stroke. Those are such medicines such as warfarin or heparin. Some individuals may not have to take blood thinners if they are not at risk for stroke, but that can be done pre-op in your pre-op blood work, and your doctor can let you know if you have to take any blood thinners prior to your surgery. But one thing about blood thinners is that it carries a risk of bleeding, and also other side effects include indigestion and heart attacks. Next, we have calcium channel blockers. The calcium channel blockers control the rate at which the heart's lower chamber pumps blood throughout the body, which is important, once again, because that irregular beat is not allowing blood flow to does not allow proper blood flow throughout the body. Other heart rhythm medications can entail medications to slow a heart that is beating too fast, or a change in abnormal heart rhythm to a normal steady rhythm. With AFib, rhythm control is an approach that most doctors recommend for people who continue to have symptoms or otherwise are not getting better with rate control medications. There are different ways that individuals can go about AFib if the medications aren't working, and there's a catheter ablation, which destroys the tissues that are causing the arrhythmia. The ablation is usually not always successful and can lead to different serious complications such as a stroke. The next procedure that can be done is an electrical cardioversion, which also helps restore your heart's rhythm using low energy shocks to your heart. Next is a pacemaker. A pacemaker can help reduce atrial fibrillation when it's triggered by a slow heartbeat. Next, plugging, closing, or cutting off the left atrial appendage. This right here helps prevent clotting from forming in the areas and causing a stroke. And lastly is a surgical ablation, which destroys the heart tissues, generating faulty electrical signals. The surgeon usually does the surgical ablation at the same time to repair different heart valves that could possibly be damaged during AFib. Those with AFib can follow a very simple FIT principle, with aerobic having their aerobic frequency 3 to 5 days. If the individual is coming from a sedentary lifestyle, 3 days minimum is good for them. But if this person has been a constant athlete, 5 days is preferred. The intensity will be low to moderate depending on the individual's condition. And usually for aerobic exercising, we want to say 20 to 60 minutes. For resistance training, it is recommended that an individual with AFib perform resistance training 2 to 3 days a week, and they'll perform more so muscle endurance resistance training versus muscle strength activities. And lastly, flexibility training 2 to 3 days a week, so it can be the most effective for that individual. Recommendations and special considerations for those with AFib. 1, an individual with AFib can be on multiple medications, and the timing of that individual on the multiple medications is very important. Next, it is important to know the medication's effects on exercise. For example, beta blockers lower exercise and heart rate and exercise and blood pressure. The calcium channel blockers lower exercise and heartbeat and blood pressure. So that concludes my project. Thanks you guys for watching.